Hi, this is Dr. Raj Kirit, consultant dermatologist in Celestee Skin Laser and Hair Clinic. I would like to talk about acne today. So what is acne? Acne is nothing but pimples, or we commonly call them as zits. So these pimples happen because of your hormones. When the hormones kick in, the oil glands on your face or on the back or on your shoulders, these areas the oil glands get stimulated and produce more oil. Once the more oil is produced, they get blocked at the pores, and that is when we call them as whiteheads or blackheads. That is scientifically termed as comedones. Now when these comedones get infected with bacteria, that is when we get the papular acne or the pimples. And if the bacteria is too much and there is a pus production, then it becomes a pustule. That is a bad pimple. And if the pustule becomes very large, then it becomes a nodulocystic acne. So the acne is mainly because of your hormonal issues. So please understand, the hormonal issues doesn't mean that you are suffering with a hormonal problem. There could be excessive response of the oil glands to the hormones also. So there are certain unknown reasons, certain known reasons. For the known reasons, we have to treat accordingly. For the unknown reasons, we treat them as if there is an hypersensitivity to the hormones and the oil glands are overreacting to the hormones. So we have to treat with the antibiotics first and then the isotretinoin. Now this acne can also be aggravated because of an improper diet or improper lifestyle, or even because of stressful situations. Please do not use any scrubs when you are having any acne. Please visit your local dermatologist to see and understand why your acne is coming back, and also please do not take the medications over the counter asking your medical shops or any cosmetic products outside the online for your acne. Kindly visit your local dermatologist, because the dermatologists are the only persons who are qualified to understand your skin properly and give a prescription for your skin. Now when we get this acne, what are the treatment options that we have? Now acne can be treated at different levels. What happens is that the bacteria is creeping in, so we can treat with antibiotics. What are the antibiotics that we can have? Either doxycycline or minocycline or even tetracycline, or the newest tetracycline group of drugs, which is the limecycline. Now this limecycline is very safe. I have prescribed to more than 300-400 patients, and the patients are extremely happy, and we get excellent results with this limecycline as well. Now in case the antibiotics are not giving us relief, then what does it mean? So how do we deal with that? Then we try to step in with isotretinoin. Now what is isotretinoin? Isotretinoin is a vitamin A isomer. It has been given in millions of patients and is been very safe, especially when it is given in low dosage. In high dosage, there could be issues. Yes, there are several myths and misconceptions about isotretinoin, but definitely this is a very wonderful drug which you can use it for acne. But this is used specifically for grade 2 or grade 3 acne, not for milder acne. Isotretinoin can be used at a dosage of 5 milligrams or 10 milligrams or 20 milligrams. Usually Indian dermatologists don't go beyond 20 milligrams as the Western dermatologists go. So we get better results, slower results, but yes, it can be very gratifying for the patient. Isotretinoin is a vitamin A isomer. It starts to act on the oil glands level, starts to regulate the oil gland, and it starts to reduce the oil synthesis on your face. So you can see a remarkable difference, but you have to wait for 4 weeks minimum. And you are supposed to get some blood tests done as prescribed by the local dermatologist. You have to get it done for the first 3 months, once in a month, and then later on it is once in 3 months, if at all we continue the isotretinoin. Now once we start with isotretinoin, there is a restriction about peels and lasers that only a dermatologist can decide on the type of skin what you have, or on the condition of the skin, or what it is changing during the course of isotretinoin. So these pimples can get cleared either with antibiotics or with isotretinoin. Please do not take these medications online, neither do continuous medication, self-medication without your prescription of your local dermatologist. And I have seen many patients who are just going to medical shops, trying to take the creams from the medical shops, just getting it for 20 rupees, 50 rupees or 100 rupees, and thinking that they can actually get away with those pimples. Please understand, those contain steroids. Please do not take online products. Those might contain steroids. Please visit your local dermatologist, take those medications, ask the dermatologist how long can you use these medications. Now the topical medications can actually be used for several months or even years, like clindamycin or nadifloxacin or benzyl peroxide. These are very safe to use. But whereas the tretinoin for ladies, if you're planning for pregnancy, you should not use it 1 month before pregnancy. So these are certain aspects that which the dermatologist will be able to explain to you by understanding your skin. So please visit your local dermatologist for all the issues of your skin. A qualified dermatologist is a must for your daily routine. When we have acne, what is that we can do? What are the different peels therapies that you can think of? Yes, glycolic acid peels, mandelic acid peels, salicylic acid peels, very wonderful fruit acid peels can be done by all the dermatologists. Now when I say acids, don't be bothered, don't be scared. See, these are all fruit acids. Now what are fruit acids? Like citrus fruits will have citric acid. So curd has lactic acid. So you are consuming every acid every day from every fruit and vegetable. So what we have done is extracted those fruit acids in a concentration of around 10% or 20%. Supposedly if you take a tomato or a lemon, how much citric acid does that particular lemon have? Probably 5%. The next lemon, it might have 3.2% or it might have 10.5%. It is variable from fruit to fruit, from size to size, from yield to yield. So what happens? We extracted those acids in a particular concentration, made it a standardized concentration, and then we apply on the skin, wash it away in a few minutes time. It's like applying papaya or tomato on your face. So what happens with that? So there is a superficial whitening of the skin, or there is a superficial abrasion of the pimples, and the skin gets clearer within a week or two. And these peels can actually help your skin. So there is no visible peeling, it is only a microscopic peeling that you should understand. People have a misconception saying that the peeling is going to be visible and we will have to sit inside the house, we cannot go out. No, it is not like that. You can apply a sunscreen, get to your work from your home, get to your office, get to your school, get to your college, it doesn't matter. But undue sun exposure has to be avoided after peels for a few days, probably for 5 days or 6 days. Then, of course, the most important thing is that the peels should be combined with the medications. It is not that you get the peels done and you don't take the medications at all. And please also understand, peels are not curative. Peels are therapeutic. They are a very good treatment option at that particular point of time. It doesn't mean it is going to cure your acne. So please understand, medications have to be given along with the peels. Then they work as catalysts. So this is how the peels can help. So this is the details about the peels. For all the other details, such as whether your skin can be amenable for peels or not, you can visit the local dermatologist or you can see us at Celestee Skin Laser and Hair Clinic, Jubilee Hills, Hyderabad. Thank you.